I'm Evangeline Thorne, and I was a night shift emergency room nurse at Meridian General Hospital in Asheville, North Carolina for 9 years. Or at least I was, until I transferred to outpatient cardiac care last month. During my time in the ER, I treated thousands of patients, motorcycle accidents, drug overdoses, massive heart attacks, domestic violence cases, construction injuries, every type of medical emergency you can imagine rolling through those automatic doors between midnight and dawn. But what I'm about to tell you is about my very first shift as a night nurse, and the patient who made me question everything I thought I knew about human anatomy, consciousness, and the very nature of what keeps us alive. It was September 23rd, 2015, and I had just graduated from the accelerated nursing program at Western Carolina University. I was 26 years old, having switched careers from marketing to healthcare after my father's battle with cancer showed me what truly dedicated nurses could accomplish. The decision to work nights in emergency medicine wasn't popular with my family. My mother constantly worried about the dangers, the stress, the emotional toll of seeing humanity at its worst moments. Meridian General serves the entire Blue Ridge Mountain region of western North Carolina, handling everything from routine emergencies to the most complex trauma cases that smaller rural hospitals can't manage. The night shift was particularly intense because we were the only level 1 trauma center within a 100-mile radius. When something catastrophic happened anywhere in the mountains, it came to us. My training supervisor was Delilah Washington, a 22-year veteran of emergency nursing who had a reputation for being both incredibly skilled and completely unflappable. She was the kind of nurse who could intubate a patient during a code blue while simultaneously directing 3 other emergencies and somehow still remember to comfort a scared family member. On my first night, she sat me down in the break room and gave me what she called her reality orientation. "Evangeline," she said, her voice carrying the weight of 2 decades of night shift wisdom, "you're about to enter a world that exists parallel to everything normal people experience. While they're sleeping safely in their beds, we're here holding the line between life and death. You're going to see miracles and tragedies, sometimes in the same hour. You're going to witness the absolute best and worst of human nature, but most importantly, you're going to encounter medical mysteries that will challenge everything you learned in nursing school. Tonight, you find out what kind of nurse you really are when the textbook answers don't exist." I thought I understood what she meant. My clinical rotations had exposed me to plenty of difficult cases, elderly patients dying alone, young people destroyed by addiction, families torn apart by sudden illness. I had studied trauma protocols until I could recite them in my sleep, practiced emergency procedures until my hands moved automatically, and memorized drug interactions and dosing calculations until they were burned into my memory. I believed I was prepared for anything that could walk, run, or be carried through our emergency department doors. I was wrong. Nothing, not 4 years of education, not countless hours of clinical practice, not even Delilah's warnings could have prepared me for what arrived at 3:17 a.m. that night. The radio crackled to life just after 3 a.m., cutting through the relative quiet of our Tuesday night shift. "Meridian General, this is Rescue 47. We have an incoming trauma. ETA 8 minutes. Female, approximately 35 years old. Industrial accident at Blackstone Chemical Processing. Severe chemical exposure to facial area. Conscious and alert. Vitals stable but unusual presentation. Request immediate trauma team activation and chemical decontamination protocols." Chemical exposures were relatively common in our area, given the number of manufacturing facilities scattered throughout the mountain valleys, but something in the paramedic's voice, a note of uncertainty, almost confusion, made Delilah pause as she hung up the radio. "Unusual presentation," she repeated, looking at me. In 22 years, when paramedics call something unusual, it means they've seen something that doesn't fit any training manual. "Get ready, Evangeline. Your first night is about to get interesting." We immediately began preparing Trauma Bay 2, laying out chemical decontamination supplies, setting up monitoring equipment, and alerting Dr. Marcus Thorne, no relation, despite the shared surname, our attending emergency physician. Dr. Thorne had been working emergency medicine for 15 years and had developed a reputation for staying calm in situations that would panic most doctors. When the automatic doors burst open and the paramedics rushed in their patient, I heard Dr. Thorne actually step backward and say, "Dear God, in all the years I worked with him after that night, I never heard him have that kind of reaction to any other case." The woman on the gurney was sitting upright, alert, and trying to comfort the obviously shaken paramedic, who was still holding her hand. But where her face should have been, there was nothing I could recognize as human features. The chemical burn had completely destroyed every facial structure. No nose, no mouth, no eyebrows, no eyes that I could identify, just smooth pink tissue that looked almost like a blank canvas where a face used to be. But she was talking. Clear, articulate, grammatically perfect speech was somehow emanating from this featureless surface. "Please don't be afraid," she was saying to the paramedic in a gentle, reassuring voice. "I know this looks terrible, but I'm not in any pain right now. My name is Cassandra Nightingale. I work as a chemical safety inspector at Blackstone Processing. There was an explosion in the sulfuric acid containment area around 2:30 this morning. I was checking the evening safety protocols when something went catastrophically wrong. Delilah and I immediately began our assessment, while Dr. Thorne conducted his examination, all of us wearing full chemical protection gear in case there was still contamination risk. What we discovered over the next hour challenged every principle of human anatomy and physiology I had ever learned. Cassandra's vital signs were not just stable, they were perfect. Heart rate 72 beats per minute, blood pressure 118/76, oxygen saturation 100%, respiratory rate 16 breaths per minute. These were the vital signs of someone in excellent health, not someone who had just survived what should have been a fatal chemical accident. Most impossibly, she was breathing normally, despite having no visible nose, mouth, or any apparent airway opening. When we used our stethoscope, we could hear clear, normal breath sounds throughout her lungs. Her chest rose and fell in perfect rhythm, yet there was no visible pathway for air to enter or exit her body. "Cassandra," Dr. Thorne said, his voice carefully controlled, "I need you to help me understand what happened. Can you describe the accident in detail?" "Of course, doctor," she replied, her voice somehow carrying perfectly despite the absence of any visible mouth. "I was conducting my routine evening inspection of the acid storage facility. Tank number 12 showed pressure irregularities on the monitoring system. When I opened the access panel to check the relief valve, there was a massive chemical reaction, essentially an acid vapor explosion. The vapor cloud hit me directly in the face before the emergency ventilation system could activate. I remember an intense burning sensation, then a strange numbness, and then, as she spoke, we could see the tissue where her face should be moving slightly, almost like skin vibrating, but there were no lip movements, no mouth opening and closing, no visible mechanism for speech production." Dr. Thorne looked at Delilah with an expression I had never seen on a doctor's face before, complete bewilderment mixed with something approaching fear. Delilah, who had told me she had seen everything possible in emergency medicine, was staring at our patient with obvious confusion. "Cassandra, I need to ask you some questions that might seem strange," Dr. Thorne continued. "Are you experiencing any difficulty breathing?" "No difficulty at all, doctor. My breathing feels completely normal. I can smell the antiseptic in the room. I can taste a metallic flavor that I assume is from the chemical exposure, but my respiratory function seems unaffected. Can you tell me how you're speaking right now?" There was a pause, and I could sense Cassandra thinking about the question. "I'm not entirely sure, doctor. I can feel my jaw moving, my tongue moving, my throat working normally. It feels like I'm speaking normally, but I assume from your question that it doesn't look normal to you." That's when Dr. Thorne made a decision that would haunt me for years. He asked Cassandra to try to open her mouth. We heard the sound of jaw movement, a wet clicking that indicated normal temporomandibular joint function, but the smooth tissue of her face showed no opening, no separation, no visible mouth cavity, yet the sound was definitely coming from that area. Within the first hour, Dr. Thorne had called in every specialist he could reach. Dr. Helena Blackwood, our head of plastic and reconstructive surgery, arrived first, expecting to evaluate a typical chemical burn case. When she saw Cassandra, she actually dropped her medical bag. "Marcus, what exactly am I looking at?" she asked, her voice tight with confusion. "I was hoping you could tell me," Dr. Thorne replied. "Chemical exposure case, but the presentation is unprecedented." Dr. Blackwood spent 45 minutes examining Cassandra's facial area with every diagnostic tool available. She used dermatoscopes, tissue thickness gauges, and even a small ultrasound device to try to understand the anatomy beneath the smooth surface. "The tissue depth is normal," she reported, "but I can't identify any of the underlying facial structures. No nasal cavity, no oral cavity, no eye sockets. It's as if the chemical reaction somehow simplified the entire facial architecture while leaving the patient fully functional." Next to arrive was Dr. William Ravencroft, our ENT specialist, who had been called to assess potential airway damage. His examination lasted over an hour and left him looking like he had witnessed something that challenged his entire medical education. "I can't locate her airway," he told Dr. Thorne privately, though Cassandra could clearly hear the conversation. "No nasal passages, no oral cavity, no visible tracheal opening, yet she's maintaining perfect oxygen saturation and normal respiratory function. This violates every principle of human respiratory anatomy." Dr. Amanda Silverstone, our hospital's leading expert on chemical exposure and toxicology, arrived around 5 a.m. She identified the chemical involved as a sulfuric acid vapor mixed with an industrial cleaning compound, which should have created specific types of tissue damage and systemic toxicity that simply weren't present in Cassandra's case. The chemical signature indicates exposure to a highly concentrated acid vapor that should have caused severe respiratory distress, internal chemical burns, and likely respiratory failure, Dr. Silverstone explained. Instead, this patient shows no signs of respiratory compromise, no systemic toxicity, and tissue changes that don't match any known chemical burn patterns. Throughout all these examinations, Cassandra remained remarkably calm and cooperative. She answered every question thoughtfully, provided detailed information about her work and the accident, and even tried to comfort the obviously distressed medical team. "I understand this is difficult for all of you," she said at one point. "I can tell from your voices that my condition is more unusual than just a typical chemical burn. Please don't worry about frightening me with the truth. I'm a chemical safety inspector. I understand the potential severity of chemical exposures. What I don't understand is why I feel so normal." As the night progressed into early morning, Cassandra's case became even more puzzling. She remained alert and conversational, showing no signs of fatigue, despite having been awake since the accident. Her vital signs remained absolutely stable, and she reported no pain, no discomfort, and no sense that anything was wrong beyond the obvious facial changes. That there were other elements that began to disturb the medical team. Cassandra seemed to have an unusual awareness of her surroundings that went beyond normal sensory perception. Despite having no visible eyes, she could accurately describe the number of people in the room, their approximate positions, and even details about their emotional states. "Dr. Thorne, you're standing about 6 feet away near the monitoring equipment, and you're feeling frustrated because nothing about my case fits your medical training," she said during one examination. "Nurse Delilah is behind you taking notes, but she's also worried about how this case is affecting the new nurse Evangeline, who is by the IV stand trying to process something that challenges everything she learned in nursing school." We had never introduced ourselves by name, and Cassandra had been facing away from where I was standing, yet she knew my name, knew it was my first shift, and seemed to understand exactly what I was thinking and feeling. How do you know our names? Dr. Thorne asked. How do you know what we're thinking? I'm not sure, Cassandra replied. Since the accident, I seem to be more aware of things, not just hearing and feeling, but sensing energy, emotions, intentions. It's like the chemical exposure enhanced some kind of perception I didn't know I had. Delilah, who had been taking notes throughout the night, stopped writing and looked at me. In 22 years of emergency nursing, she had never encountered anything like this. As dawn approached and our night shift was ending, the medical team faced an unprecedented decision. Cassandra's condition was stable, but completely unexplained. Every specialist who had examined her left with more questions than answers. Her case didn't fit any known medical category, and there were no established protocols for treating a patient who was medically impossible. Dr. Thorne made the decision to admit Cassandra for extended observation and consultation with specialists from Duke University Medical Center and the National Institutes of Health. As the day shift team prepared to take over her care, Cassandra asked to speak privately with me. Evangeline, she said, somehow turning her featureless face directly toward me, despite having no visible eyes. Come closer, please. I approached her bedside, still wearing my protective gear, still trying to process everything I had witnessed during my first night as an ER nurse. This is your first shift, isn't it? She asked gently. Yes, ma'am, I replied, my voice barely steady. I want you to know that what happened to me tonight, whatever happened to me, it's not just about the chemical accident. Something else occurred during that exposure, something that changed me in ways that go beyond what your medical training can explain. You're going to be part of understanding this mystery, Evangeline. I can sense that about you. This case is going to follow you throughout your nursing career. As they prepared to transfer Cassandra to the ICU for extended monitoring, she asked a question that would echo in my mind for years. Evangeline, in your training, did they teach you about the parts of human experience that medicine can't measure? The aspects of consciousness and awareness that exist beyond what we can see and quantify? I didn't know how to answer. Nothing in nursing school had prepared me for a patient who could perceive thoughts and emotions, who could function normally without visible sensory organs, who could speak without a mouth and breathe without airways. Because what happened to me tonight, Cassandra continued, suggests that human beings are far more complex and mysterious than medical science currently understands, and I think you're going to be one of the nurses who helps bridge that gap between what we can measure and what we can't explain. As they wheeled Cassandra away to the ICU, Delilah put her hand on my shoulder. In 22 years of emergency nursing, I have never encountered anything like what we just witnessed, she said quietly. Some cases change you, Evangeline. Some cases change how you see medicine, how you see patients, how you see the human body, and what it's capable of. This is going to be one of those cases. She was absolutely right. But what happened over the next several days would prove that Cassandra Nightingale was not just a medical anomaly. She was the beginning of something that would challenge everything the medical community thought it knew about human consciousness, perception, and the hidden capabilities of the human body. The woman with no face had secrets that went far beyond her impossible anatomy, and those secrets would haunt me for the rest of my nursing career. When I left Meridian General Hospital that morning, after my first night shift as an ER nurse, I thought I had witnessed the most medically impossible case of my career. Cassandra Nightingale, a woman who could breathe without airways, speak without a mouth, and perceive thoughts and emotions without visible sensory organs, had been admitted for extended observation and consultation with specialists from major medical centers. But I didn't know was that Cassandra's case was about to become even more mysterious, and that I would be called back to the hospital within 48 hours to witness discoveries that would fundamentally change how I understood human consciousness, medicine, and the hidden capabilities of the human body. The phone call came at 2:30 p.m. on Thursday, September 25th, just as I was trying to catch up on sleep before my next shift. It was Delilah Washington, my supervisor, and her voice carried an urgency I had never heard before. Evangeline, I need you to come in immediately. It's about Cassandra Nightingale. The specialists from Duke and the NIH have made some discoveries, and she's asking for you specifically. She says you need to be here for what they're about to reveal. When I arrived at the hospital, I found the ICU buzzing with activity unlike anything I had ever seen. There were physicians from Duke University Medical Center, researchers from the National Institutes of Health, and even a team from the Centers for Disease Control who had flown in specifically to study Cassandra's case. Dr. Patricia Moonwhisper, a leading neurologist from Duke, had been conducting extensive tests on Cassandra for the past 36 hours. When she briefed the assembled medical team, her findings challenged every principle of neurology and human anatomy. "Ladies and gentlemen," Dr. Moonwhisper began, "what we're dealing with here is not simply a case of unusual chemical burn recovery. Our advanced imaging studies have revealed anatomical changes that should not be possible in a living human being." She pulled up a series of MRI images on the large screen in the conference room, where Cassandra's facial structures should have been. The scans showed something that looked like a complex network of new tissue formations, not damaged or destroyed anatomy, but entirely new biological structures that served no identifiable medical purpose. "The chemical exposure appears to have triggered some kind of spontaneous tissue reorganization," Dr. Moonwhisper continued. "Instead of destroying her facial anatomy, the acid somehow catalyzed the development of what I can only describe as alternative sensory and respiratory pathways. It's as if her body evolved new ways to perform essential functions while eliminating the traditional anatomical structures." Dr. Benjamin Stormcloud, from the NIH's National Institute of Neurological Disorders, had been conducting consciousness and perception tests with Cassandra. His findings were even more disturbing. Miss Nightingale demonstrates cognitive and perceptual abilities that exist well outside the normal range of human capability, he reported. She can accurately describe objects and people in rooms she has never been in, identify emotional states in individuals she has never met, and demonstrate knowledge of events occurring simultaneously in other parts of the hospital. These abilities suggest some form of enhanced consciousness or perception that we currently have no scientific framework to explain. But it was Dr. Sarah Nightfall, a biochemist from the CDC's Chemical Exposure Division, who presented the most shocking discovery of all. "We've analyzed tissue samples from Miss Nightingale's facial area," she announced. "The chemical composition shows cellular structures that don't match any known human tissue types. It's as if the chemical exposure didn't just change her anatomy, it transformed her into something that is technically no longer entirely human from a biological standpoint." The medical team made the decision to perform an exploratory surgical procedure to better understand Cassandra's new anatomy. Dr. Helena Blackwood, our plastic surgeon, would lead the operation with assistance from the visiting specialists. "Cassandra had agreed to the surgery with one condition: she wanted me to be present in the operating room as her advocate and emotional support. It was an unusual request, but given the unprecedented nature of her case, the medical team agreed. Evangeline, Cassandra said to me the night before the surgery, what they're going to discover tomorrow will challenge everything the medical community believes about human potential. I need someone there who understands that this isn't just about medicine, it's about the evolution of human consciousness itself." The surgery began at 8 a.m. on Friday, September 26th. I stood in the corner of the operating room, wearing full surgical gear, watching as Dr. Blackwood made the first incision into the smooth tissue of Cassandra's face. What we found beneath the surface defied every principle of human anatomy I had ever learned. Instead of the expected damaged or destroyed facial structures, we discovered an intricate network of new biological systems. Where her nasal cavity should have been, there was a complex arrangement of tissue that appeared to filter and process air through microscopic pores distributed across the surface of her face. Where her mouth should have been, there was a sophisticated vibration system that allowed her to produce speech through harmonic resonance, rather than traditional vocal cord function. Most impossibly, where her eyes should have been, we found what Dr. Moonwhisper described as consciousness receptors, clusters of neural tissue that seemed to process information from sources that weren't limited to traditional sensory input. "This is not human anatomy," Dr. Blackwood said quietly as she continued the exploration. This is something entirely new. It's as if the chemical exposure triggered some kind of evolutionary leap that compressed millions of years of adaptation into a few hours. But the most shocking discovery came when Dr. Stormcloud used specialized equipment to measure the electrical activity in Cassandra's brain during the surgery. While she was under general anesthesia and completely unconscious, her brain showed patterns of activity that suggested she was not only aware of what was happening but actively participating in the surgical procedure. She's somehow conscious during general anesthesia, Dr. Stormcloud reported, his voice tight with disbelief. Her brain is showing patterns that indicate not just awareness, but enhanced cognitive function. It's as if anesthesia can't affect whatever type of consciousness she has developed. As if to confirm his findings, Cassandra's voice suddenly filled the operating room, clear and calm, despite the fact that she was supposed to be completely unconscious. Blackwood, you'll find the most interesting structures about 2 centimeters deeper, just beneath the layer you're currently examining. And Dr. Stormcloud, yes, I can hear everything you're saying. This new form of consciousness doesn't follow the same rules as normal human awareness. The surgical team spent the next 4 hours documenting and studying the new anatomical structures they had discovered. When they finally closed the incision and Cassandra was moved to recovery, Dr. Moonwhisper called an emergency meeting of the entire medical team. What we've discovered today challenges not just our understanding of human anatomy, but our fundamental assumptions about consciousness, evolution, and the potential of the human species, she began. Miss Nightingale has not simply survived a chemical accident, she has undergone some kind of spontaneous evolutionary transformation that has enhanced her physical and mental capabilities, while eliminating the limitations of traditional human sensory systems. She represents something that is technically post-human from a biological standpoint. Dr. Stormcloud presented the consciousness studies that had been conducted over the past 3 days. Miss Nightingale demonstrates abilities that can only be described as telepathic or psychic in nature. She can perceive thoughts, emotions, and events at a distance. She can communicate with individuals through direct mental contact. She appears to have access to information that exists outside the normal bounds of space and time. But it was Dr. Nightfall's final chemical analysis that provided the most disturbing revelation of all. The tissue samples we've analyzed contain cellular structures that are not just different from normal human tissue, they're actively evolving, she reported. The chemical exposure appears to have triggered an ongoing transformation process that is continuing to modify her biology at the cellular level. Miss Nightingale is not in a stable condition, she's in a state of continuous evolution. That's when Cassandra herself joined the meeting. She had somehow left her recovery room and made her way to the conference room without anyone noticing, despite having just undergone major surgery. I wanted to be here for this discussion, she said, her voice carrying an otherworldly quality that hadn't been present before the surgery. Because what you've discovered about me is just the beginning. The chemical exposure didn't just change me, it activated something that was already present in human DNA, something that has been dormant for thousands of years. Moonwhisper stared at Cassandra with a mixture of fascination and fear. What are you saying? I'm saying that what happened to me can happen to others. The chemical exposure was just a trigger for an evolutionary potential that exists in all human beings. The consciousness and perceptual abilities I've developed, the new anatomical structures, the enhanced awareness, these are capabilities that the human species is meant to have. I'm not an anomaly, I'm a preview of what humanity is becoming. Over the following weeks, Cassandra's condition continued to evolve in ways that challenged every aspect of medical science. Her enhanced perceptual abilities grew stronger. She could communicate telepathically with individuals hundreds of miles away. She could perceive events occurring in other dimensions of reality that were invisible to normal human consciousness. But perhaps most disturbing of all, she began to demonstrate the ability to trigger similar transformations in other people through direct contact. 3 weeks after her surgery, Dr. Blackwood reported that she had begun experiencing enhanced perceptual abilities after spending extended time working with Cassandra. Dr. Stormcloud developed the ability to sense the emotional states of patients throughout the hospital. Even I noticed changes in my own awareness and intuition that far exceeded anything I had experienced before meeting Cassandra. She's not just evolving herself, Dr. Moonwhisper told me during one of our private conversations. She's somehow catalyzing evolution in others. Everyone who has direct contact with her begins developing similar abilities. The medical community was faced with an unprecedented situation. Cassandra Nightingale represented either the next stage of human evolution or a dangerous contagion that could fundamentally alter the human species. The debate raged for months in medical journals, government committees, and international health organizations. But for me, working with Cassandra on a daily basis as she continued her recovery, the question wasn't whether her transformation was dangerous, it was whether humanity was ready for the changes she represented. My own experience working with Cassandra changed not just my understanding of medicine, but my fundamental perception of reality itself. The enhanced awareness that developed through my contact with her allowed me to become a better nurse in ways that couldn't be measured by traditional medical standards. I could sense when patients were in distress before their vital signs showed any changes. I could identify medical conditions that wouldn't be detected by conventional diagnostic methods for days or weeks. I could provide emotional comfort to patients and families in ways that went beyond anything taught in nursing school. But the changes also came with challenges that were difficult to process. I began experiencing what could only be described as psychic phenomena, visions of future events, telepathic communication with patients, awareness of medical emergencies occurring in other parts of the hospital before any alarms sounded. Evangeline, Cassandra said to me during one of our conversations, "What you're experiencing is not supernatural or mystical, it's simply human consciousness operating at its full potential." For thousands of years, our species has been functioning with only a fraction of our true capabilities. The chemical exposure didn't give me new abilities. It removed the limitations that were preventing me from accessing abilities that are natural to human beings. This perspective helped me understand that my enhanced nursing abilities weren't a violation of medical science, they were an expansion of it. I learned to integrate my intuitive perceptions with traditional medical knowledge, creating a more complete and effective approach to patient care. However, not everyone in the medical community was ready to accept these changes. Some physicians and administrators became uncomfortable with my new abilities and questioned whether they represented legitimate medical practice. The tension between traditional medicine and evolved consciousness became a constant source of conflict in my career. 6 months after her initial accident, Cassandra made a decision that would forever change my understanding of her true nature and purpose. She announced that she was leaving the hospital and the traditional medical system to establish a new kind of healthcare facility that could integrate evolved consciousness with conventional medicine. "Evangeline," she said during our final conversation at Meridian General, "I want you to understand something important. My accident wasn't really an accident. I was meant to undergo this transformation, and you were meant to be there to witness it and learn from it. This entire experience was orchestrated by forces that operate beyond normal human awareness." She explained that there were others like her around the world, individuals who had undergone similar evolutionary transformations through various triggers and were working to help humanity transition to its next stage of development. "The woman with no face that you met on your first night was not the end result of a chemical accident," she told me. "She was the beginning of a new chapter in human evolution, and your role in this story is far from over." Cassandra established the Nightingale Institute for Evolutionary Medicine in the mountains outside Asheville, where she continues to work with patients who are undergoing their own consciousness transformations. Many of these individuals seek her help after experiencing phenomena that traditional medicine cannot explain or treat. I visited the institute several times over the years and was amazed by what I witnessed. Patients with terminal illnesses experiencing spontaneous remissions through. Dr. Benjamin Stormcloud from the NIH's National Institute of Neurological Disorders had been conducting consciousness and perception tests with Cassandra. His findings were even more disturbing. Miss Nightingale demonstrates cognitive and perceptual abilities that exist well outside the normal range of human capability, he reported. She can accurately describe objects and people in rooms she has never been in, identify emotional states in individuals she has never met, and demonstrate knowledge of events occurring simultaneously in other parts of the hospital. These abilities suggest